Good evening, Doc. Good evening po sa lahat. Now we continue with the tongue diagnosis made easy sa partially swollen tongue body. While an entirely swollen tongue will be due to an excess condition of dampness, phlegm, or accumulated fluids, a partially swollen tongue can be a sign of a deficiency or excess condition. Qi deficiency, Qi stagnation, and heat can all result in the swelling of a certain areas of the tongue. The areas of the tongue that most often swell up are the tip, so yung unahan ng tongue, the central area, and the edges of the tongue, so sa gilid. If the sides are swollen, it is important to differentiate between whether it is the whole side of the tongue that is swollen, which is a liver imbalance, or just the side in the central area of the tongue. So kung sa side, yung central area ng side, it could be a spleen Qi deficiency. If the swollen sides are also red, this indicates liver heat. So reddish coloration. If they are normal in color, there will be a liver Qi stagnation. Okay? Liver heat, pag pula, pag normal ang color, liver Qi stagnation. The reason that the spleen Qi deficiency can result in swelling of the sides of the tongue, which is an area normally associated with the liver and gallbladder area, is that the spleen area in the middle of the tongue swells. This forces the sides of the tongue outwards in this area. The spleen Qi deficiency swelling will usually result in there being teeth marks on the sides of the tongue. If there is phlegm dampness or Qi deficiency in the lung, there will be swelling of either the whole of the front third of the tongue or just the side of this area. So pag merong phlegm dampness or Qi deficiency, so yung po yung sa front third ng tongue. The tip of the tongue can swell when there is a heart imbalances. This will usually be seen if the mental emotional aspect of the heart, the shen, is not in balance. The tip will usually be red in this situation. So tandaan po natin, pag merong heart imbalance, we could check dun sa coloration ng tip, which is usually red, and associated sa mental emotional aspect ng condition ng patient. A swelling on the side in the liver area is very common and usually indicates liver heat. It is nearly always associated with the red color in the same area. So since this is a liver heat, so liver area, which is this side, and there is a red color of these sides of the tongue. A swelling on the sides in the chest, breast area generally indicates either retention of phlegm in the chest or breast or lung Qi deficiency. So ito naman po yung front na nagsiswell associated with the chest, breast, or lung Qi deficiency. A swelling of the tip of the tongue usually associated with the red color is very common and indicates heart heat or heart fire deriving from severe emotional problems. So if there is an emotional condition, we could associate this with heart heat, heart fire. Okay? So ma-observe natin ang swelling ng tip of the tongue. Okay? Next, a swelling of the front third of the tongue indicates retention of phlegm in the lungs. So pag in-observe po natin itong mga pictures, swelling of the front third of the tongue, ito po sa may tip. Another picture, swelling of the front third of the tongue, ito yung nagre-represent ng lung area. Okay? Tongue with teeth marks or scalloped tongue. The tongue with teeth marks refers to the tongue where the indentations of the teeth are visible along the lateral and anterior edges of the tongue body. So sa tongue with teeth marks indication, we have dampness. Ang tongue body niya is pale and moist. While sa spleen deficiency, ang tongue body is slightly pale. Sa pathogenesis, in both cases, water or dampness stagnate in the tongue, which causes the tongue to grow wider, leading to the edges being compressed by the teeth. Sa remarks, teeth marks may also be seen in the healthy person. So we have to confirm or ask the patient about their condition kung associated ba yung swelling of the tongue, because it could also happen to a healthy person. Okay? So next we have comparison between flabby, teeth marks, and swollen. Sa tongue body enlargement, ang flabby, positive. Meron siyang sa teeth marks, may or may not be present. Ang vertical thickness, present. Ang horizontal thickness, +3. Ang stiffness of the tongue body, not present. And physiological or pathological may or may not be present. Sa teeth marks naman, ang tongue body enlargement is present. Ang teeth marks niya is +3. And vertical thickness is present. Horizontal thickness present. While there's no stiffness of the tongue body. Sa physiological or pathological, may or may not be present. So sa indication, damp, it could be damp, phlegm with or without spleen, kidney yang deficiency. Sa swollen naman, ang tongue body enlargement is +3, while ang teeth marks may or may not be present. Ang vertical thickness is +3, horizontal thickness is present, and the stiffness of the tongue body is +3. +3 din ang physiological or pathological significance niya, while the indication niya is heat, alcohol toxin, and blood stasis. Sa remarks, teeth marks may occur with either a flabby or swollen tongue. However, a flabby or swollen tongue may not have teeth marks. The flabby and swollen tongue may occur simultaneously. Okay po? Next, we have uneven sides of the tongue. Swollen on the whole half of the tongue. The nutritive chi flow with the blood. Together, they nourish the organs, muscles, tendons, and sinews, and circulate and fill the channels and collaterals. Chi and blood deficiency present not only with the pale tongue body, but also with uneven sides to the tongue. Sabi ng author, in my experience, this tongue sign represents impaired circulation of chi and blood in relation to the right or left half of the body. Again, the affected side of the tongue does not necessarily correspond to the affected side of the body. The same interpretation obtains when only one half of the tongue is swollen. In this case, the swelling shift the midline of the tongue. So, pag na-observe natin yung may swelling on one side, yung midline nag-move to the other side. Symptoms associated with this type of tongue are weakness in one half of the body and lack of strength or stamina on one arm or leg. Occasionally, this type of tongue will be seen in atrophy disorders. Okay? So we have here another tongue picture of a female 35 years old. Observe natin mabuti. That tongue is pale, which indicates that there is a spleen chi deficiency. There is also uneven teeth marks on the left side. So sa left side, check natin, which indicates that there is lack of nourishment in the channels and collaterals due to chi and blood deficiency. There is also light yellow, greasy coating. So kung titingnan natin maigi, there is, this indicates that there is acute food stagnation. Sa symptoms, there is sharp pain in the left hip upon exertion. There is lack of mobility of the hip joint. There is extreme muscular tightness of the quadriceps, acute stomach ache, and there is a loose stools. Sa Western diagnosis, meron siyang bilateral degenerative joint disease of the hip. Sa background to disease, there is an excessive consumption of spicy food, lack of exercise, and mother took opiates during pregnancy. Okay po. So we have another case of a female 30 years old. Observe natin yung tongue. There is pale, slight teeth marks, which indicates that there is a spleen deficiency, accumulation of dampness. Meron siyang swollen center, which indicates that there is a phlegm obstructs the stomach. Also, may uneven sides to the tongue. Ibig sabihin, lack of nourishment in the channels and collaterals due to qi and blood deficiency. Ang symptom ng patients is tendency to catch cold. There's a fatigue, black nasal passages or runny nose with copious white discharge. There's also fullness in the epigastrium, feeling of weakness on the left side of the body, feeling cold. There's none sa Western diagnosis. Sa background to disease, there is excessive physical exercise in connection with dancing competition. There's also irregular eating habits, excessive consumption of dairy products, and chocolate. Okay? So we have a case history. This 30-year-old woman complained of a persistent fatigue and constant cold that always left her with a runny nose. The nasal discharge was copious, thin, and white. The left half of her body felt weak. Despite all of this, she forced herself to complete a daily exercise routine, which took up to 6 hours in preparation for an important dance competition. She took great care not to gain weight, which resulted in irregular eating habits. She felt that food was not being digested properly, as she often experienced fullness in the epigastric region after eating. She felt cold very easily. The tongue body was pale and showed unevenness on the sides of the tongue. The pulse was slippery and frail. Okay? So sa analysis, the fatigue and feeling of cold were the direct results of spleen deficiency caused by the excessive training routine and irregular eating habits. The pale tongue, especially swollen in the center and sides, support this diagnosis. So makikita po natin sa swelling. In general, damp phlegm is a result of an underlying spleen deficiency, which prevents the spleen from properly transporting and transforming solids and liquids. The presence of damp phlegm here led to obstruction of the qi mechanism of the middle burner, manifesting in epigastric fullness, and also showed itself in the copious nasal discharge and slippery pulse. The damp phlegm blocks the circulation of qi and blood in the channels, collaterals, and muscles, which contributed to the one-sided feeling of weakness in the body. So sa discussion, swollen or uneven tongue sides often indicate insufficient nourishment of the channels, collaterals, and muscles. The underlying cause for this is a deficiency of spleen qi and yang that gives rise to accumulation of dampness or is aggravated by external dampness or cold dampness. Patients with this condition are advised to change their diets and abstain from vigorous exercise. So we have here another case of a female 50 years old. Sa tongue, it is pale red, slightly swollen, which indicates that there is a spleen qi deficiency or accumulation of dampness. One half of the tongue is swollen and meron siyang midline shift. So this indicates that there is lack of nourishment in the channels and collaterals due to qi and blood deficiency. The tongue is also thin and has a wet coating. which indicates that there is accumulation of dampness. Ang symptoms, there is morning stiffness, joint pain upon exertion, pulling sensation, and weakness in the left thigh. There is also spasm in the calves upon exertion, and there is exhaustion. Sa Western diagnosis, meron siyang multiple degenerative joint disease. Sa background to disease, injuries due to a car accident 2 years ago and overwork. Okay? So we go to the swollen tongue sides. A deficiency of spleen, qi, and yang presents with a swollen tongue body as well as broad swelling on both sides of the middle third of the tongue. Note that the sides are swollen only in the middle of the tongue. So tingnan po natin mabuti. The signs must not be confused with swollen sides that extends over the entire length of the tongue body, which signifies a disharmony of the liver. Okay? Pag the whole length ng tongue, this is a disharmony of the liver. Pero pag sa middle third of the tongue, this is a spleen qi deficiency. Spleen qi and yang deficiency. Okay? So next, we have another case of a female, 40 years old. Observe natin yung tongue. There is a slightly pale swollen, especially on the middle part of the sides. So this indicates that there is a spleen qi deficiency, accumulation of dampness. Meron siyang slightly dry, which indicates that there is a blood deficiency, and meron siyang depression at the root. So tingnan po natin yung pinakalikod ng tongue, which indicates that there is a essence deficiency. Ang symptoms, there is a migraine since 9 years of age, migraines now preceding and following menstruation. Severe hair loss, there is a panic attack since childhood. There is none sa Western diagnosis, and sa background to disease, family history of migraines, overwork at home and on the job, and irregular eating habits. Okay? So next patient, we have a female, 25 years old. Ang tongue po niya is pale, slightly thin. Middle part of the sides are swollen. So this indicates that there is a spleen qi and blood deficiency. Meron siyang white thin slippery coating, which indicates that there is accumulation of cold dampness. Ang symptoms, there is headache, pain at the nape of the neck, there's fatigue, and there is weight gain. There's none sa Western diagnosis, and sa background to disease, excessive consumption of sweet foods, excessive worrying. Okay? So sunken areas, some areas of the tongue can appear to have sunk downwards. This indicates a condition of qi deficiency in the organ that is reflected in this area of the tongue. The depression in the tongue surface can sometimes only be seen immediately after the person has presented their tongue. And then the area fills up and the depression is no longer visible. It is sometimes necessary to get the patient to extend their tongue a couple of times to be sure that you have observed the depression correctly. On the other hand, an area of the tongue may only collapse after the tongue has been extended for a while. In both cases, this will most typically be seen in the area corresponding to the lung. So usually po yung sunken areas, makikita po sa area ng lung, sa spleen, or sa stomach, and is indicative of qi deficiency in these organs. If the root of the tongue is sunken, so sa likod, this can be a sign of kidney zinc deficiency. Okay? So thank you po for your attention.